Hi, I'm Dr. Rodríguez-Feliz, board-certified plastic surgeon here in Coral Gables, Florida. Today, I'm going to talk to you about very common questions. Are women candidates for hair transplant? In short, the answer is yes. A lot of patients that come to us are female patients, and a lot of them actually can have hair transplantation. Now, treating hair loss in females is completely different than treating hair loss in a male patient. About 50% of the females that present for hair loss has some sort of underlying cause related to it other than just a genetic predisposition. So the first mindset when I treat a female patient, when we see them in consultation, is to really dig into their history. Why are they losing their hair, and try to identify if there is any medical condition related to it. A lot of the time it's actually hormonal, related to the perimenopause period. A lot of the time it's related to a thyroid issue or anemia from some other source. Our goal is to identify these things before putting them in a treatment plan. So once all that is taken care of and the patient has no other issues, and we think this is related to, in fact, a genetic predisposition, then these patients, we go ahead to decide if the hair loss is diffuse or if more localized, and if we can actually harvest hair from the back of their head to put it into the areas of concern. And if this is the case, then the patient is actually a candidate for a hair transplantation. So a lot of females think that there is no hopes and they are not candidates for hair transplants, and this is not true. Now, where do we transplant hair in female patients? So many times you can see actually females that have receding temples, very similar to a male pattern hair loss. And these patients can be treated with hair transplants to improve their hairline, which, different from males, a hairline in a female patient, it's more rounded in that area. They start losing hair along the part, and sometimes it starts to get more diffuse, and these are areas that can be transplanted as well. Another very common area where we transplant hair in females is actually the eyebrows. Many women know about the microblading, which is essentially doing some sort of temporarily or semi-permanent tattooing to the brow area that mimics hair, by actually marking the area in a particular or specific way. The problem with this, they look great for 2 or 3 sessions, but when the females perform this procedure for a long time, then you start to lose definition of that hair, and everything starts to look almost as a tattoo, the whole hairline. So we always favor some hair into the eyebrow, and this is achieved by hair transplantation. In this particular cases, we prefer a small strip method where we harvest a small strip from the scalp in the back. All the hair follicles are cut and they're separated under the microscope, and then they get implanted in the right directions into the eyebrows. And there's another very common procedure that we perform in male and in female patients, and this is a forehead reduction. So a lot of female patients with long forehead, they're actually a better candidate to have a forehead reduction, which is a surgical procedure where we can actually lower the hairline by removing some excess skin in the forehead. And this is a preferred method in patients that need big advancement of the forehead, because if we were to do hair transplant in these patients, the density a lot of the time is not as we want. So these are just 3 things that we can perform to treat hair loss, receding hairlines, and in fact actually loss of hairs in the eyebrow for female patients, which contrary to common belief, where females cannot be treated or the hair loss cannot be treated, we can actually help you in many cases.